So at the last ASH annual meeting, we have presented the data of Blinatumomab and Inotuzumab for treatment of multiple relapses in ALL, which come from an analysis deriving from a multi-center experience, real life, in many Italian sites belonging to the so-called campus ALL group. We all know that both Blina and Inotuzumab are approved by FDA, EMA, and also IFA in our country for the treatment of relapsed refractory ALL patients with B-cell leukemia. However, we know that the majority of the patients after this treatment, in particular if they are not able to proceed to an allogeneic stem cell transplantation, relapse. And little is known of their outcomes after recurrence and retreatment with subsequent immunotherapy approaches. So our aim was to describe the outcomes and survival and response of a quite wide cohort of patients with relapsed refractory ALL patients treated with both Blina and Ino in any sequence. So before Blina and Ino after, or vice versa, Ino and then Blina after, at different disease recurrences. Globally, 71 patients were identified from 19 Italian hematological centers with a median age of 34 years. And among these patients, 22% were Ph positive ALL. At the time of the first immunotherapeutic approach, so Blina or Ino, median previous treatment lines was 2. So these were patients who had already received a quite prolonged time of treatment before. And median time between ALL diagnosis and first immunotherapy was 15 months. The majority of the patients with Ph negative ALL as first line had received a pediatric-like approach, which is the standard of care today in our country. And on the other side, in Ph positive ALL as first line had mostly received the TKIs alone or TKIs in combination with standard chemotherapy. In some cases, there was also an extramedullary involvement in Blina and then Ino treated patients, which is quite frequently observed in subsequent relapses with B-ALL in Ph positive, but also in Ph negative setting. The median follow-up from immunotherapy start was 16 months, more or less, and 33 months from initial diagnosis of ALL, and 34% of the patients were still alive, and 22 are still alive in CR. 4 patients, so 6% of all the cohort, died in CR for VOD during stem cell transplant after salvage treatment. What we observed globally is that in these very poor prognosis patients, these data are quite similar to what are already being reported by some important randomized and registrational trials such as Tower and Innovate trial in terms of CR, and also in terms of median overall survival, 7.7 months globally. A subsequent approach with Blina and Ino, or with Ino and Blina after, seems to be feasible because we didn't observe any kind of additional adverse events or toxicity, and also an important efficacy was detected. So what is the final message that we would like to give is that the global strategy of these patients should include 1 or 2 immunotherapeutic approaches followed by allogeneic stem cell transplantation in order to consolidate the response.